turn this on recording. And it's lovely to have you here today.
Yeah,
You want to tell us a little bit more about your background? I mean, we had a little summary, but just to go over it.
sure.
Yeah.
I am a general dentist with a focus in airway and sleep medicine, or dental sleep medicine. We do a lot of airway analysis and treatment through appliance therapy and Invisalign to help create a more favorable arch form and airway so people can get great sleep.
Awesome. Um,
Yeah.
so if someone is thinking about, they're sleeping, they're a side sleeper, they're a face sleeper, they're a back sleeper, what is kind of the constrictions, or what kind of happens with these airways from like our lungs up through our brain? But
Sure. So a lot of the work that I do is with patients suffering from obstructive sleep apnea or upper airway resistance syndrome. So what it is a lot of times when we're sleeping, whether it be on our side, more so on our back, actually, we tend to have our tongue collapse into the airway. So it essentially obstructs it. So our tongue, along with our soft tissue, including our soft palate, our uvula, our tonsils, adenoids, everything is essentially blocking that airway from opening and getting oxygen while we're sleeping. So what we see a lot of times is poor sleep, fatigue, a lot of mental and physical health difficulties, development and growth in children. We see that a lot. So what we look for in a person that comes in saying, I just can't sleep at night, or my spouse is saying, or my partner is saying, I snore tremendously. We want to look to see if they are on a lot of different medications, such as high blood pressure, diabetes. We want to look dentally if they are presenting with a small arch form. So that means a lot of crowding in the mouth. And then on top of that, we want to look for signs and symptoms of, fatigue, tiredness, sleepiness, and see, is it related to their sleep or is it related to other factors? So there are a few different things, when we're looking for it, we're not just saying, oh, you have crooked teeth, you must have sleep apnea. We want to see for a combination of things. And then we go from there and do a really in-depth analysis and say, this is kind of what your sleep is, being troubled by: a small mouth and a large tongue. We have, girth in the neck that can be contributing to the obstruction of the airway. And a lot of times we'll say all this obstruction is leading to a desaturation in oxygen. And then that desaturation in oxygen puts your body into like a sympathetic overdrive as you're sleeping. And that sympathetic overdrive is just waking your body up every little while to breathe. And some people go unnoticed. Recently, I had a few patients who the appliance we had given them was working great in reducing the obstructions, but their fatigue was just not resolving. And it's because we have those autonomic awakenings, meaning we don't realize you're not waking up and gasping for breath. Your body is doing it internally. So you're still not getting rest. And when you don't get that rest, you're sluggish, you're that brain fog, your mind just isn't on point, and your body doesn't get to clear the toxins or work in the way that it was intended to. So you see a lot of those medications pop up on the patient history, or people falling asleep at the wheel while they're driving. So it just has a huge implication on our life, both mentally, physically, lifestyle wise. So that's why, one of the reasons why I definitely got into sleep was just because of how it affects your life in all aspects.
Yeah. Well, and with what you're talking about, I mean, someone can not even, it can be so subtle, right? Like the difference between a little bit more oxygen and not enough is so subtle that you wouldn't necessarily notice it, and people are going around without recognizing that that's the cause of their issue. And they, maybe they're going and getting, like you said, more medications and more this, and then with lack of sleep becomes you increase weight gain and other aspects of that. So that makes a lot more sense. Have you looked when you're doing this treatment, are you analyzing people while they sleep? Do you have like monitors and things for while they sleep, or is it all done in the office?
Sure. So what we do is we have them go home with a home sleep test. We use Whisper, there's Knox 3, there's Sleep there's a whole bunch of different types of ones depending on the clinician's preference. And so we send them home with that, and then we'll get 1 or 2 nights depending on the individual, and then we'll analyze it. There's software that comes with it, and it'll analyze it for us, and it'll give us the amount of times they stop breathing, the amount of times their heart rate spiked over 90. It'll give us min and max of heart rate. It'll give us different oxygen levels at how long the percentage was of each oxygen level. It tells us a few different metrics, RDI, RERAs. These are more sleep specific measurements that essentially will tell us how many times that autonomic awakening was, how many times there was a clear obstruction, meaning the airway was completely obstructed and the amount of airflow was just minimal. So these are the numbers we look for. And then ultimately it'll give us the information to essentially say, you fall within the range of mild, moderate, or severe sleep apnea, or maybe none at all. And then from there, we can say, let's speak with your sleep physician or your primary care physician, whomever you're working with, and go from there, get a diagnosis. And then if you fall within a moderate to mild range, typically, if your physician agrees, we'll get a prescription for a sleep oral appliance, is what we work with in our dental office. And then we use that to help alleviate the obstruction by essentially moving the bottom jaw forward. And how that helps is when you sleep at night, the mouth, we want to sleep with our mouth closed and breathe through our nose. Oftentimes we're breathing through our mouth. So years of breathing through our mouth creates an enlarged tongue space. And if you're doing that from childhood, you're not getting the expansion you need in your arches, in your dental arches. The tongue is the natural palatal expander. So when you sleep at night, your tongue rests on your palate. That expands it as a child. And when you don't have that, what happens is you become small, constricted. And as we breathe with our mouth, our tongue continues to kind of enlarge because it doesn't have the constriction of the dental arch. So when you lay back and you don't have the space for the tongue, it starts to drift backwards. And then along with your soft palate and your tonsils, it can obstruct the airway. So your body will wake up, when it wakes up in those autonomic periods or when it's trying to remove an obstruction, your bottom jaw is the quickest and fastest way to open up the airway by moving it forward. So your body will start to move it forward. You get all this oxygen, your body goes into more of a relaxed state, and you can breathe again. And then what happens is the tongue falls back again. You wake up, your body wakes up. You may not be conscious when it's doing it, and it moves forward again and back. So you have that grinding pattern.
Right.
So when you hear people say, I grind my teeth at night, it's because I'm stressed. It could be a psychological, mental component with it, but most cases we see are oxidative stress, meaning you just are not getting enough oxygen and your body is responding by doing what it knows, and that's opening the airway by moving your bottom jaw forward.
Oh, wow.
So oral appliance therapy helps set that bottom jaw slightly forward so it creates an opening in the airway and you don't have to grind.
So
it's an alternative.
Could be buying one of those mouthpieces and thinking like, oh, I'm grinding my teeth, I just need to stop grinding my teeth. And they're really just having airway constriction.
Yeah. And in the past, and I know so many people do this not understanding airway and sleep. And it's out of good nature. You're trying to help somebody by giving them a night guard. And the thing is, if you have sleep apnea or you have upper airway resistance syndrome, in some patients, because the night guard can open you slightly, it might help them. They might say, wow, I'm sleeping so much better with this night guard. But it's usually short term. And for some patients, you're opening them, but you're obstructing them at the same time. So it's an added obstruction in the mouth. So it actually worsens their sleep apnea. And they're like, I just can't sleep with it. I'm having such a hard time breathing with it. And that's because they're making the situation worse. So I always recommend that if a patient comes into my office and says, Doc, I don't think I have any sleep issues, I'm just grinding my teeth, I will not make a night guard for them unless they take a sleep test, because I could be worsening something without knowing what it is. So I want you to be completely cleared before I can give you that night guard. It's a better way to approach it, because if, for instance, you do have a mild sleep apnea, I can make you a better appliance that's going to adjust your bottom jaw slightly and correct not only the breathing and the sleep, but also the grinding. So to me, it's just more powerful and more a long-term solution than just to say, let me get you a night guard, or let me do Botox in your masseters. We see that a lot more now. You get the Botox here, and I always question, has that person taken a sleep test? Have they addressed the underlying situation? And in many cases, we make you an appliance and you still grind a little bit, go for the Botox. That's an amazing solution for relaxing these muscles. But if you're doing it to mask the underlying condition, that's not helping you in the long term.
So when someone is going through and trying to come up with this, do they look for a specific kind of dentist? Because it seems like not all dentists are really trained for this.
So a lot of dentists are American Academy of Dental Sleep Medicine qualified or certified. So you can go through that website as well. But a lot of them aren't. You don't have to be to do a lot of airway and sleep work. You can literally, there's a few different groups now coming up that are looking for, that created databases for people who are looking for it. I think there's Airway Circle as well. There's one of those. But honestly, you want to look for somebody who does talk about airway and sleep a lot. I think functional dentistry, there's Ask the Dentist has a huge functional database where you can find a lot of dentists that are working with airway and sleep as well.
Okay. Wow. I just know that's something that a lot of people aren't necessarily even aware of, that this is part of the problem to search for. Because when I was working with that other dentist that specializes in this, and TMJ and all these terms I had never even heard of, right? And they're just they're not common. So anything else you think you want to add, or that you think would really be helpful to people to kind of explore, what their options are, what you kind of have seen as maybe an alternative if this isn't the issue?
Sure. If you go in and get a sleep test done and you don't have obstructive sleep apnea, sleep hygiene is going to be one of your best friends in learning just how to prepare yourself for a good night of sleep. But then also, I think a lot of times we tend to struggle with sleep because our mind and we can't shut it off. We have like a racing mind. And in today's world, everything is causing stress and anxiety. It's just a lot of stuff going on, and especially in the last 2.5, 3 years. So for me, a lot of what I do in my sleep coaching and sleep programs is just managing the mind, learning how to journal, reduce anxiety, encourage nasal breathing, breathing techniques. The 4-7-8 technique is fantastic. Box breathing is fantastic. So, just learning how to not put so much emphasis on the importance of sleep. I mean, I'm coming from both realms, because in my dental practice, sleep, we encourage oral appliance therapy to encourage really good sleep. But I think if you're not suffering from a sleep disorder, physically, like obstructive sleep apnea or anything of that nature, then when it comes to struggling with things like insomnia, you want to make sure you're not making sleep not making it a deal breaker, for instance. So if you get 5 hours of sleep one night, you may be tired that day, but you're not going to develop diabetes. You're not going to develop hypertension just from 1 or 2 or 3 weeks of bad sleep. If you feel that you have an underlying health condition, I urge people to always get treatment by a sleep physician or get analyzed by a sleep physician before just saying, I don't have any of these things and I'm completely, free of all these sleep disorders, because these are huge sleep disturbances narcolepsy, circadian rhythm disorders, sleep apnea. Anytime you have a sleep disturbance, it's going to encourage your insomnia to get worse or your trouble sleeping to get worse. So it's kind of hand in hand, where we want to make sure your underlying conditions are diagnosed before you can figure out, why you're not sleeping well. So I feel like that's a big thing for a lot of people is I'm not sleeping well, so I'm going to just take magnesium and melatonin and I'm going to just do all of that. Well, why are you not sleeping well? Is it because we can't, turn off our mind? Is it because we're not able to, decompress at the end of the day? Or are you suffering with something more? So to me, that's a big thing as well, because I come from both sides of it. And I see a lot of my clients, they're like, I just can't sleep. I just can't sleep. I'm like, well, have you seen somebody besides, a coach for it? Have you seen a medical professional for it?
Yeah.
So I think that's really important as well, is not just relying on one side of the coin, but kind of looking at the flip side and saying, hey, let me get my blood work checked out. Let me get my hormone levels checked out. Let me get, my airway checked out and see if that's something more than just I'm having trouble sleeping. But I think it goes hand in hand in this. And I think that's what makes sleep so complex, is it's not just one way or the other. And I think it's so multifactorial that it really does take a team to get, someone who's really struggling on the right path. So to me, that's really important, just to emphasize that, just one thing, if it's working for somebody else, it may not work for you. And that may be because you have something else going on underneath the covers, So I think that's really important for me to emphasize to people. Don't give up, because, we'll find it. We'll figure it out, but it's there. We just need to do the right digging and the right understanding of what's going on.
Yeah. Well, and I mean, you gave kind of a variety of options, from starting with a sleep test to, orthodontics, to going and just working on your mental focus, or shifting entirely to your overarching health. Right. And so I think for people who are just kind of struggling, I think we'd love to just see in the comments below what you've done, and then maybe we can provide what could be done from here. So I thank you so much for your time today.
You're very welcome.
Yeah,
you're very welcome. It was great speaking with you about this. It's it's such an awesome topic, especially in today's day and world, when everyone's kind of like burning out, we're overworked, we're undersleeping and all that stuff. So it's great to just have these tips to really just see what's going on.
Yeah, for sure.
Hi everyone, I wanted to introduce you to this awesome product that I used on my flight to Vancouver recently. It is a lifesaver. I had an early flight and I needed something to help me get some sleep, and this was it, the Sleepbzzz headband. Light blocking, and it has these awesome headphones here that let me get some great rest during my flight. Definitely check it out if you need it for your next one.